Nutrients for depression.
So there are at least 13 nutrients linked to our risk of depression and depressive disorders. So for this video, let's look at just three of them. Let's look at vitamin B6, vitamin B12, and omega-3 fats. In a 2020 study that looked at the association between 43 different nutrients and the risk of depression in menopausal and elderly women, the only one found to have a significant impact was vitamin B6. They showed that for every 84 micrograms of vitamin B6 per day, risk of depressive symptoms decreased by 20%. That is a tiny, tiny fraction of the daily value of vitamin B6. So a potentially huge effect. And the benefits of vitamin B6 for mental health have been shown in younger people too. For example, a 2022 study in college students with self-reported anxiety and/or depression showed that compared to a placebo, a high-dose vitamin B6 supplement for just a month led to lower scores on a screening for anxiety-related disorders. Now we know that people with depression tend to have lower levels of vitamin B12. And there seems to be a direct link between our levels of vitamin B12 and synthesis of depression-linked neurotransmitters. And lower levels of vitamin B12 going into pregnancy increases the risk of developing prenatal depression. We also have a number of studies showing that the long-chain omega-3 fats found in seafood, EPA and DHA, lower the incidence of major depressive disorder, bipolar depression, and prenatal depression. And studies where they give patients with major depressive disorder a fish oil supplement and show benefits to their depressive symptoms on par with Prozac. But really talk to your doctor before swapping your Prozac for fish oil. That's not actually a good idea. It's just interesting from a clinical trial perspective. And when it comes to omega-3 fats, EPA is probably the important one here. A meta-analysis of 26 studies showed that supplements that contained at least 1 gram of EPA produced really big improvements in depressive symptoms, but supplements that were DHA only didn't seem to have much benefit. I really want to emphasize that depression is multifactorial, and this is just 3 out of the at least 13 nutrients that are important here. First, it's why Nutrivore is such an important dietary philosophy, because the goal is to get all of the nutrients our bodies need from the foods we eat. And you can learn more about that in my book, Nutrivore. But also, nutrition is not the only point of intervention when it comes to depression. And addressing nutrient shortfalls is not a guarantee that you'll be able to discontinue your SSRIs. So this is definitely a talk to your doctor topic.